today for Cancer Conversations event. I am L. Terry Strickland, bosses of Omega Beta Beta chapter of Omega Psi Phi Fraternity Incorporated, and I will serve as your moderator for this event today. Today's conversation is part of a collaboration between members of Omega Psi Phi Fraternity Incorporated and Mayo Clinic's Community Outreach and Engagement Team. This series of conversations explores topics ranging from prostate cancer risk factors to survivorship. This session marks the third of four in the series. We invite you to join us for the final session on June 18th, held on a Thursday evening. We are grateful for the opportunity to bring this discussion to our communities. Also, I would like for everyone to please drop in a chat what organization or chapter they are representing here tonight and your city. Few housekeeping tips. Everyone except speakers are in webinar mode, and so if you have questions, please use the Q&A pane at the bottom on your screen. We invite you to share this webinar link with others to join us. There will also be a pre and post survey and other scanning opportunities during today's session. And for our speakers, we'll be reminding you with gentle cues when your time is almost up. So let's get started. It's a privilege and honor to welcome Chelsea Reeves to lead our next section.
Thank you so much, Mr. Strickland. Good evening, everyone. I am Chelsea Reeves, Senior Program Coordinator with Mayo Clinic Center for Community Outreach and Engagement and Research Services. Can you hear me okay? Can I get a thumbs up from a couple of folks? Okay, perfect. Awesome. So Mayo Clinic's Cancer Conversation series is designed to bring physicians, researchers, and communities together to share and learn more about various types of cancer, their signs and symptoms, treatment, resources, and the benefit of participating in clinical trials. And in this particular event, we hear directly from our survivors and our caregivers who share their unique lived experiences. These conversations are designed to educate us and knowing our health risks and stay up to date on screenings, which empower us to take charge of our health. So thank you all for being here. As Mr. Strickland said, please put your where you're tuning in from. Please let us know. We'd love to give you a little shout out. And thank you all for being here. And please encourage others to join. It's not too late. If our tech team members, if you could put the link to the current cancer conversations, if you could put that in the chat for us so that those that are participating, they can just copy paste it and then send it to a friend. Thank you so much. So the next thing we want to do is to bring up our pre-survey. So what we do with our pre-survey, everyone, is this really gives us an opportunity to gauge your level of knowledge before we start the discussion for today. We've got some really exciting speakers for you, and we really want to talk and learn a little bit more about what you are aware of right now before we even get into it. So we're going to give you about 2 minutes to scan this QR code. And then also, if it's easier for you, you can click the link in the chat. I think either Chad or Nicole will put the link to the pre-survey in the chat so that you can access it that way if it is a little bit better for you. So we'll give you about a minute or two to go ahead and get that scanned, and then we can move on with the program. Thank you so much. And while you're doing that, I see a couple of people from different areas of our service area and also out of the state. So we've got Monroe, uh, North Carolina. We have Apopka, Florida. Some folks in the state. Tucker, Georgia. Thank you all so much for being here. We greatly appreciate you. It's not too late to share that link that first link that Chad mentioned or put in the chat. You can share that with someone and encourage them to participate. There is feedback in the audio. Okay, let's see if we can get that addressed. Thank you so much, Mr. Powell. Okay. All right. So if you are having any audio problems, we apologize for that. If you could maybe log off and then log right back in, maybe that could help because we're a couple of people are able to hear us just fine. So we apologize for that inconvenience. If you're able to hop off and then hop right back on, hopefully that will make a difference. But we are recording this particular event as well. So if for some reason we're not able to get that feedback all clear, it'll still be recorded, and then we will send that out at a later time. So thank you so much for taking time out to complete the pre-survey. We will ask you to complete a post-survey after the conversation is completed. So keep those fingers ready and those scanning activities ready. And now I'd like to pass it back over to Mr. Strickland to continue on with our program. Thank you so much.
Thank you. It's indeed an honor to introduce our subject matter expert, Dr. Ewan Cobrand. Dr. Cobrand is a senior associate consultant and career scientist in the Department of Quantitative Health Sciences at Mayo Clinic, Arizona. He earned his PhD in pharmaceutical science from Howard University College of Pharmacy with a research concentration in pharmaceutical health service research, pharmacoepidemiology, and pharmaceutical outcomes policy. His scientific contributions have been recognized through numerous honors, including the National Cancer Institute Early Investigator Advancement Scholar Award in 2025, and NCI Mentored Research Scientist Development Award 2020 to 2026, and the Jonas A. Loudon Young Investigator Award in 2019. He has also been named a Ken Lang Scholar at UCLA, Research Methods in Supportive Oncology Scholar at Dana-Farber Harvard Medical School, and a 40 Gators Under 40 honoree by the University of Florida Alumni Association in 2023. Dr. Ewan Cobrand, the floor is yours.
Thank you so much, Mr. Strickland, for that wonderful introduction. And one of the things this is such an important conversation that we're having tonight. Um, this is, I've had a long day and we all have a long day. And I just want to say, this is the most favorite thing that I'm doing today. Like I'm really, really excited to have this conversation. So I'm going to go ahead and share my screen and get started. Let's do slide blue. All right. Okay. Can you see the slides or are you seeing the full slides?
Great.
Okay. Okay, we're all set. So once again, thank you all for taking your time out for this community conversations on prostate cancer treatment. This is a critical conversation. And one of the things when I say critical, I say it's an important conversation because I want to empower you as men to make sure that you are an advocate for your healthcare. You're an advocate for your screenings, you're an advocate for appropriate treatment, and you're an advocate for having a conversation. Medicine is a shared conversation between the patient and the doctors. And so I want you to be an advocate for your healthcare. Before we get into the treatment, I want to talk just briefly about the stages of prostate cancer and why early detection is so important. The first stage is stage one. This is the lobe of the prostate. So there's two lobes of the prostate, right? And so as you can see here for stage one, the cancer is identified or is isolated to one lobe and it usually starts small. When we progress to stage two, these are both the cancer has spread to both lobes of the prostate. So lobe one, lobe two, and it gets a little bit bigger. When we get to stage three of the prostate, you can see the cancer has spread to both lobes, but then it also starts to spread to the seminal vessels. When we get to stage four of metastatic prostate cancer, as you can see, the cancer is getting a lot bigger. It has spread to the lymph node, and then up here, this is your bladder. So from stage one, you see that nothing is in the bladder. So, when you get to metastatic prostate cancer, it is spread into other organs. So the reason why this is important and the reason why I start out in terms of prostate cancer treatment, a conversation or community conversation about prostate cancer treatment by showing you a demographic or show you the various different stages is because if a man is diagnosed at stage one, stage two, you know, or early, I would say early. I'm an advocate for early prostate cancer diagnosis. I really want to empower you to make sure that you stay on top of your health. If you feel something off, talk to your doctor, talk to family members, talk to someone that can help you. Because once you get to stage four, it's not out of your, it's all hope is not lost, but there's so much more stuff we have to do, or so much more stuff doctors have to do to make sure that you're treated. You're having to do radical treatment, and there's just a lot of things on the body. And so, as opposed to if you're diagnosed stage one or two, I would say early prostate cancer diagnosis is stage one. So the treatment, so treatments for prostate cancer include surgery, radiation therapy, and medicine. And we're going to talk about these different types of treatment. And then medicines for prostate cancer include hormonal therapy or hormone therapy, chemotherapy, targeted treatment, and immunotherapy. We're going to talk about those as well. Sometimes some men for prostate cancer don't need treatment right away. There's this protocol called active surveillance. And active surveillance is essentially where you and your doctor, you're watching and you're monitoring, you're active. So surveillance means you're watching, right? So if you're doing active surveillance, you are actively monitoring, you're redoing your PSA testing every 6 months, and your doctor is watching. It's not essentially, okay, we're doing this active surveillance and you don't see your doctor for 3 years. That's not active. There's no part of that that is active. Active surveillance means that you and the provider, that relationship between you and that primary care provider is so important because you're actively watching. And so essentially, that's what active surveillance is. You're not essentially receiving treatment right away. You're just watching to make sure that it doesn't spread or develop any further. So the next thing for in terms of treatment is surgery. So surgery for prostate cancer involve removing the prostate. So that's typically what happens in prostate cancer surgery. And then I'm going to talk about the various different types of surgery. So there's two types. And so the first type is laparoscopic, and it's just a small incision. That the surgery makes small incisions into the belly, so small incisions into the belly, and the surgeon puts surgical tools through. The surgeon will put surgical tools through the cuts or the small incisions in the body, and then use that tool, those small incisions, to remove the prostate. So lower downtime, a smaller incision, and so this is typically, in terms of surgery for prostate cancer, that's some of the things that we're currently doing. Then there's also robotics. So instead of the surgeon, well, the surgeon is still doing it, but essentially it's a robot that's manipulating and performing the surgery. And so essentially the arms of the robot hold the surgical tool, and then most prostate cancer treatment operations, most of them use robotic surgery. And so this is essentially gone are the days where you're getting these huge long cuts and you're taking months to heal. So it's usually more a smaller incision and then lower downtown. I had knee surgery maybe 2 years ago, and I did a laparoscopic robotic knee surgery, and it was a small incision. I was in and out, and then my downtime was pretty low, and so it's the same kind of things here. Medicine has evolved as it relates to. And then radiation treatment. So radiation treatment, you see this gentleman, he's on the table and he's being essentially he's being treated, right? So radiation therapy treats the cancer with powerful radiation beam. External beam radiation is one of the type of radiation that is used for prostate cancer. It involves using a machine to aim beams of radiation at the body. And so that's essentially a type of treatment, so radiation therapy. You can also receive hormonal therapy for prostate cancer. Um, and that's essentially the hormone that most men have, or all men have, is testosterone. And so in most cases, we want to reduce the testosterone level or keep it from reaching the prostate cancer cells. And so what we do know is that prostate cancer cell relies on testosterone to help grow. And so in most cases with hormonal therapy, we're trying to reduce the testosterone or lower the testosterone level to kind of stop it from feeding the cancer or the prostate cancer cells. Side effects of hormonal therapy includes hot flashes, because remember, once we're reducing testosterone. So hot flashes is possible, trouble sleeping, loss of muscle, and then also increase of body fat. There also can be loss of sex drive, and it can be more difficult to have an erection because we're reducing the testosterone. Other hormonal therapy can risk includes increased chance of getting diabetes or heart disease. So those are some of the side effects of hormonal therapy. So I was able to quickly run through, and I'll be here for a conversation. And so that was the last slide as it relates to hormonal therapy. I do have a quick video as it relates to at Mayo, in terms of the treatment options. And so I'm going to go ahead and play that. Let's see. Let's make sure. I know what to do. 1 second. I'm going to share again. I'll try another way. Let's just share the whole screen. If we're not able to do the video, we'll definitely send it to you. I just want to make sure that we're cognizant of the time. So I'll turn it back over to the other co-moderators. But Chelsea, we can definitely send the video later on.
Okay, no problem. Thank you so much.
Thank you, Dr. Cobran, for that information. Definitely, our guests are invited to put their questions in the chat, so please continue to do so. Next, I want to introduce Brother Nate Carrington as one of our next speakers. Brother Carrington is a retired federal corrections leader with nearly 30 years of service from the U.S. Department of Justice, Federal Bureau of Prisons. He's held multiple leadership positions across the institutions nationwide and is past bosses and a lifetime member of Omega Psi Phi Fraternity Incorporated. He is very active in his church and community and now spends his time mentoring, serving, enjoying time with family, and rooting on his beloved Knicks. Here you go, ladies and gentlemen, Nate Carrington.
Go New York, go New York, go. Good evening to everyone. As you said, my name is Nathan Carrington. I go by Nate often. I'm 68 years old. I've been married to my wife, Patricia Guilford Carrington, for 42 years, coming to 30th this month. I have two adult children, one who's an attorney and an urban farmer in the St. Louis area, and my other is my daughter, who's an OBGYN here in the Orlando area, who has her own practice. I have three grandchildren who I love dearly. As he said, I'm a member of Omega Psi Phi fraternity for 47 years. I was initiated at the Majestic Southside chapter, Kentucky State University, in which I graduated at Kentucky State University in 1980. I'd like to start off with, I guess some people go through issues with medical issues in life, and you kind of think you have one episode and you're done. But prior to my prostate issues, I was diagnosed with a condition called vasculitis. And when I had it, it was like for a year before, several months before the doctors and all were aware of what I had. So at that point, I thought I was being treated for that. I thought I was done with all my medical issues. Lo and behold, here comes my prostate issues. I had been going to my oncologist, as you would say, off and on for several years, and no problems going to see my doctors. I kind of go to my doctors when I was working, and sometimes give me a day off from work. I ain't had no problem paying my co-payment, so the paid day. But as a year out before my discovery, I had prostate cancer. My PSA numbers were starting to rise, and the medical staff became concerned. My numbers at one point had gone from 3.2 to 4.1 at one visit, and it was at that point that my doctor decided we needed to do a biopsy. And I want to stress that I guess it was it's very important that you take your loved ones with you, because at times you forget to tell the doctors things that may be going on with you. But then I had my wife there; she would key in to say, "Hey, this was happening," or "That was not happening." But only symptoms that I really can recall that I had an increased urination in the evenings. My Dr. Edwards, excuse me, Dr. Troy Edwards, had taken samples, and the procedure he gave me was something very similar to a colonoscopy. The reason I wanted to point that out, after speaking with several other individuals who have had the prostate cancer, they explained to me most of their doctors had done the procedure, had taken the samples right there in the office, and they really complained about how sometimes it was very unpleasant. However, mine's no problems at all. I was just like a colonoscopy. I had put under. The samples were taken, and then I went back to him. My results came back, and 12 samples were taken. 8 of the 12 had revealed traces of prostate cancer, and I had a Gleason score of 8. At that point, Dr. Edwards provided me with the pros and cons of having radiation treatment or the removal. But he made a point that it was going to be my decision. But he did point out to me, he said that he normally recommends to his patients, those who were 60 and under, he would have them strongly consider having the removal. And those who were 70 and above, the radiation. And from what he was explaining to me was that it all had to do with based on life expectancy, because of I guess prostate cancer grows so slow. At the time, I was at the age of 66, so I was in between the 60 and 70-year mark. And what really came down to, after a discussion with my family, was that there was no need. There was no more children being planned in our family, so we decided that it was best for me to go ahead and have to do the surgical. This came after discussion with my wife and my daughter, who I indicate is a physician herself, and she had contacted some colleagues of hers that she had gone to med school with, and who family members had also had prostate cancer. So we decided to go ahead and do I had the robotic surgery, and this took place on April 22nd, 2024. After my surgery was over, I remember one of the first things Dr. Edwards told me was, he said to me, we did the correct thing. We did the best thing for you. He said, because it appears that my cancer could have possibly spread if we had not removed it, which I became, very shocked. And I was glad that that's the procedure that we're taking. I've gone back now to see him on several times, and my PSA now has gone to a 0.04, and I thank God for that. And regarding, I had purchased 2 of the pads, 2 packs of pads, and that was 2 years ago. And I just basically have 1 pack still left, a half a pack. And I guess because I haven't really had any issues with the leakage throughout. Occasionally I'll have leakage, and if I feel maybe it's leakage, I'll use a pad if I know it's going to be hard for me to get to a restroom somewhere. But I really haven't had any problems with the leakage, and this has been, like I say, been going on 2 years. But one thing that kind of stuck out to me in my last visit I had with Dr. Edwards was last week, and I may have missed this as part of our discussion. I had asked him, what stage was I? And he told me at that point I was stage 1 and in group 4 and 5. And he said, it indicated that being a part of that group 4 and 5 is a strong indication that your cancer could spread. And after I hear that, I thank God again for being able to have me have my cancer, that I'm cancer free right now. And I really thank the love and support of my family to the point where I'm at right now. I consider myself a normal life at this moment. Some slight changes in my life, but overall, I'm doing fine, and I just thank God for it. I appreciate everyone listening to me this evening. If you have any questions, feel free to ask me.
Thank you, Brother Carrington, for your testimony and sharing your insight into your journey. Our next speaker is another survivor, and that is the Reverend Dr. Brother Sidney Crudup. He is the senior pastor of New Bethel Missionary Baptist Church in Sanford, Florida, and holds a doctorate in transformative leadership. He is also the founder of Cope Leadership Academy, which supports at-risk youth through practical education. A dedicated community leader, Dr. Crudup has been married to his wife, Sandra Brookins Crudup, for 27 years and is a proud member of Omega Psi Phi Fraternity Incorporated. Brother Crudup, the stage is yours.
Yes, sir. Thank you, Brother Strickland. As noted, I am Dr. Sidney Crudup II, 57 years old. And as has been noted, I've been married to the lovely former Sandra Brookins for 27 years. We have no biological children. Proud member of the Omega Psi Phi Fraternity Incorporated, made in the mighty Omega Beta chapter in 2024. And what Brother Strickland also failed to mention is that I am also rooting for my beloved New York Knicks. So in my journey, blood work, slow urine stream, all the symptoms pointed towards the issue of possible cancer. And of course, when I was diagnosed, my initial reaction, it was calm. I was rather subdued. Didn't experience any great deal of anxiety, but I was concerned, but I wasn't worried. Because in my mind, being a disciple of Christ, being a pastor, being a preacher, it was what it was. I knew that I eventually would have to go through something, and I felt that this was my lot. And I think one of the reasons why it snuck up on me is that throughout my life, I have never really been sick other than a common cold. And of course, as a child, my bout with chicken pox. But other than that, I was not one to really pay too much attention to my health. I'm just being honest. That has changed. So after my diagnosis, I simply told my primary care physician to order the next steps in the process, having no idea what to expect. I was not about to worry about it. I was just ready to go through it. Fast forward, of course, my physician ordered my biopsy. Absolutely horrible experience. Very intrusive procedure, not something that I revel in reflecting over. And in my case, I had to have it twice because of my initial diagnosis. They caught it very early in stage 1, and it was a slow-moving cancer, as the doctor had already just stated. It hadn't moved into the other wall or to the other side of the prostate. So we watched it, active surveillance. So by the time of the second biopsy, it had moved closer to the wall of the prostate. So now I had to make a decision. I had to decide exactly what I'm going to do here. So with that came the mental struggle. My physicians were saying that because of my age, they did not recommend radiation. Of course, I think I was 52 at the time. Because in the event the cancer would return, I'd be stuck with it because radiation and surgery would no longer be any treatment option. So I went back and forth and back in the mind. And then I finally decided on the robotic surgery. I was a little apprehensive about it, particularly after they explained what it would mean for my life going forward. It was life-changing, major lifestyle changes. Now, my surgery was in 2021. In fact, 2 days ago, June 9th, was the 5th anniversary of it. And I'm still feeling some of those effects of that change even today. So one of the major issues that I found that was bothersome after my surgery was the catheter. Once again, another horrible experience. I was stuck in the house for a little bit, not bedridden, but all of my time spent on the Lazy Boy. God was gracious because my wife was a huge help. Sandra helped me to bathe. She helped me to dress. Now, this is for someone who's used to doing things on his own. And she did all of that without complaining. So in suffering from this condition, I had to readjust my entire philosophy about myself, about her. I had to look at life differently because I was no longer the same person, and I would not be able to return to that person. So circling back to the lifestyle changes, many of them I'm still dealing with 5 years later. There's some incontinence, as my brother Nate mentioned. There's some leakage, not as bad as it was at first due to doing Kegel exercises. Prostate survivors had let me know that these were the exercises that I needed to perform to control the leakage, to control the incontinence. But at times I still have to wear padded underwear. I guess one of the good parts about it is that once the prostate was removed, my urine stream came back to normal. I was no longer struggling to urinate. So I'll end with this because I don't want to drag this out. Overall, people who have gone through this same condition have been very, very supportive. I'm glad I was able to express this here because I'm not one for talking about this in detail. And this is the first time I've really talked about it in this amount of detail since my surgery. I'm doing a better job of monitoring my health now. I'm making regular visits, drinking a lot of tea, listening to what my doctors are telling me, although there's still much more room for improvement. So I just want to thank everyone for listening and allowing me to share just a small portion of my story. And I'll yield with that.
Thank you, brother, Pastor Dr. Crudup, for your testimony, sharing your insight and your experience. Now we want to open it up for any questions out there. I'll take any questions. I think some may have posted out there. Are there any questions out there?
So far, so clear, but everyone, please get those questions in and we'll answer those as they come in. But so far, so clear.
Okay. Thank you, Chad, for monitoring the chat. Next, we're going to turn it back over to our beloved co-host, Chelsea Reeves, who will lead us into the next section.
Awesome. Thank you so much, Boslin Strickland. We really appreciate that. Gentlemen, thank you so much for sharing your story. So powerful. We've heard a lot of different nuggets, and hopefully everyone that has joined the call, we have about 39 people on this call, and I'm sure that there is something that you heard from one or both or all of our speakers that you can hang your hat on and share with someone else and try and encourage them to take charge of their health, identifying any symptoms, anything that's changing in their bodies, not to be afraid, but to immediately go and seek treatment or discussion with their doctors right away. We are the first persons to know if anything is wrong with us. So using that to our advantage, let's continue to be educated, encouraged, and empowered to take charge of our health. So thank you all. Thank you so much, Reverend Crudup. Thank you, Mr. Carrington. Thank you, Dr. Colbrand. And we will I want to ask if Nicole has that video to share because we can just take a quick moment to do that. Nicole, is that ready?
Yes, just give me 1 second. I'll
Okay.
totally share.
Not all prostate cancers are equal. Some of them are serious and require multiple different treatments for cure, but some don't need treatment at all. It all depends on when the prostate cancer is diagnosed, how far it's spread, and what kind of prostate cancer it is.
The genitourinary practice at Mayo Clinic is organized across our 3 campuses, Minnesota, Arizona, and Florida. We have a very large genitourinary practice comprised of urology, radiation oncology, and medical oncology.
We assess the patients all together as a team and to make sure we are delivering the right treatment at the right time.
Prostate cancer right now is a rapidly moving field in terms of the treatment options that are becoming available to patients.
When the prostate cancer is just in the prostate, things such as surgery, focal therapy, radiation therapy, or when that cancer is spread to other areas where you may need more than just one particular treatment for cure of the disease. That may mean things like surgery and radiation and hormone therapy or chemotherapy.
In the realm of radiation therapy, we have been able to see that shorter courses are as effective or a little bit more effective than longer courses, so we can treat the patient a little bit faster.
The most exciting new development for prostate cancer patients is the FDA approval for lutetium-177 PSMA-directed therapy. The attraction of this drug is that the PSMA molecule takes this radioactive isotope and delivers it precisely directly to the prostate cancer cell. Now, along with the lutetium treatment, there is new imaging that's PSMA-directed.
Nuclear medicine imaging detects things at the cellular level, at the tissue function level, which can detect things at an earlier stage.
The same molecules that help us see the cancer from nuclear medicine, we can attach a payload of either chemical or radiation particles to it. So instead of radiating your whole body, they will target the specific areas of prostate cancer.
Without question, we see our purpose at Mayo Clinic as driving the field forward, existing on the cutting edge, trying to find those cures.
The most important thing that's reassuring is that you have a team of individuals dedicated to you and your individual cancer.
Thank you so much. So what we'll do when we get ready to send out the recording, we'll make sure that that video is also attached. As you noticed, that was on YouTube. So a lot of our videos, short videos, 3 to 4 minute videos are on YouTube, and you're more than welcome to go and check those out because they are made for the general audience. Basilisk Strickland, I do see some questions in the chat. Do you want to facilitate those for our speakers? And if you're speaking, you're on mute.
There we go. Sure. Let me get to the Q&A, I think, over here. First question looks like, in looking back on your experience in having survived prostate cancer, what would you do different prior to being diagnosed? Philip Carrington, would you like to answer that?
Yes, what would I do differently?
Yes.
Looking back on it now, I don't think with anything I would do differently. I guess once I became aware of it, personally, I just wanted to go ahead and get it done. I didn't want to, linger around and debate, should I do it? What should I do it? Should I do radiation? My thing was, like my wife always tells me, hey, you've had some changes in your life, however, you're still here. And one of the main things I didn't bring up was that, one of the reasons I did the removal was I was told that if you did the radiation and for some reason your cancer had come back, then, and like Brother Carter said, there's nothing that could be done. So I don't think there was anything I would have done differently. Want mine removed so I can enjoy the rest of my life that I have in front of me.
Okay. Thank you for answering that. Next question. I'm gonna see if Pastor Crudup can take this one. How have your lifestyle changed since you completed your treatment, i.e., dietary habits, exercise, etc.?
Yes, the lifestyle changes. I have been very much more surveilling. I've been paying attention to any and everything that's going on in my body. As I think I stated in the presentation, I've been drinking a lot more teas, trying to remove sugar. I know I can't remove it completely, but just watching my diet. Recently, I just started Tai Chi exercises, the walking and the chair exercises. Just making certain that I stay on top of every issue that may come up, because that it's prostate cancer and one thing, somewhere down the line, it could be something else happening in the body. So I just try to stay on top of the health issues and make certain that I monitor whatever I take in, watching the calories, watching the sodium, watching the sugars, just making certain that I don't allow anything in my body to make any situation worse. So that surgery definitely changed my outlook as far as how I need to approach health.
Okay. Thank you again, Pastor Crota, for that insight. Last question. I think I'm going to pass it to Dr. Cobrand. This is a question from Mr. Alan York from Monroe, North Carolina. He's actually a nephew of one of our members here, Ray Collier. It looks like Alan is going to be having a robotic prostate procedure on June 22nd, 2026. And his question is, what should I expect during and after surgery? Dr. Cobrand, would you mind providing some insight to that question?
Sure. So I think this is an appropriate question for some of our survivors who have actually, because their testimony is so powerful. Like, I really, and the fact that they've gone through some of this, like Reverend Dr. Kudrup, I think that this is a question that he can answer. But not only that, but I'll just briefly say, based on having robotic surgery, is that, smaller incisions, that kind of stuff. I'm a more researcher on the side of things, so not MD, PhD, but at the same time, what we're seeing now with these robotic surgery and these laparoscopic surgery, small incisions, and so you probably have an excellent medical team that's going to monitor you for side effects post-surgery, but at the same time, I would like to hear from some of the survivors who have had the surgery, because I think they can give you the lived experience of how their life has been impacted. So Reverend Dr. Kudrup, I think
Yes.
I'd like to hear from you.
Yes, what to expect. Now, in my situation, I'm just going to be transparent again. And many of my brothers already know this. Having too much weight on you, specifically in the core area, that caused my surgery to be an hour and a half to 2 longer than it would normally have been. So I was on that gurney for 5 to 6 hours. And so that I don't know exactly what his condition is as far as his frame, as far as how he's built or anything like that. But I will say that whenever they're going into the prostate through the belly, it's very much easier when someone's in shape. So what he can expect, and he may be different depending on how his health is. I was in the VA hospital for maybe 3 days post to make certain that everything internally was working. They had to make certain that you can use the restroom. They had to make certain that you were walking, typical surgery stuff. And again, I don't know how his situation, but as I stated in the presentation, wearing a catheter, I think it was 3 to 4 weeks I was wearing that. And that's a complete change, because you're walking around with this bag on the side of you, and you have this stuff inside of you to make certain that your bladder drains. So he might have to experience that. And then once the catheter is removed, yes, you'll have the stronger urine flow. But as Brother Nate was saying, and as I've experienced, in the early going, you may experience leakage. So you may have to have padded underwear or something that you have to wear. And it can happen at any time. It can happen from you sneezing. It can happen from you coughing. If you try to bend over to tie your shoes, that can be an issue. So it's going to be like that for a while and I strongly suggest the Kegel exercises so that you can get back to somewhat of normalcy. But overall, it was good for me, going back to what Brother Nate was saying, because it had moved closer to the wall and it could have spread somewhere else. So, but that's pretty much my experience. If he's healthy, if he's strong, if he's young, he may be able to move around a little bit more than me. I had some other issues with arthritis and with gout. So that kind of kept me pretty much on the lazy boy. But Overall, the surgery is pretty successful. I haven't heard any horror stories on it, and certainly I didn't have any horror stories. It's just a matter of being inconvenienced for a while.
Okay. Thank you, Pastor Crudup. And I think Alan has shared some of his biomarks in the chat. One thing I would probably advocate is, the support system is great, and I don't know how we can connect people who either have questions now or later, but this is definitely something that I think the conversation should continue both pre and post. So thank you, Dr. Crudup, for sharing that insight. With that being said, I don't see any. So one more question in there.
Yeah,
Make sure
there's one in the chat, Mr. Strickland. I think it's probably directed maybe at Dr. Cobrand. But the question is, why are the observation periods so far apart? A lot can happen during that time.
And I'm thinking that the question is about active surveillance. Why is the okay, right? So that's a good question. So I think for the most part, I would say the active surveillance can depend on your relationship with your doctor and how often you want to go in and have your observations or your rescans or your retesting. And so I think for the most part, if you're actively engaging with your physician and you're having dialogue, you're seeing your physician on a regular basis. I think I love the story that Dr. Reverend Kudrup mentioned, was that he was doing active surveillance and then he went back in and retested, and he was not comfortable with where the margins were, right? And so I think that's a perfect example of active surveillance. You don't wait 3 years, because you can go from being early stage to all the way, at a later stage diagnosis. And so I think along the lines, you're absolutely right. What you don't want to have is you don't want to have a long time between when you started your active surveillance protocol and then you're going in to see your doctor. And so I think that's a good thing. Yeah.
There is one last question here about May. This came from Andrew Knowles, and he states that we've heard that African Americans are at higher risk for prostate cancer. Why is this, and what should younger Black males do to reduce the risk?
That's an excellent question. Yes, African American males are at increased risk for developing prostate cancer. Some of this are lifestyle factors. Some of this is genetics. Sometimes where genetics are passed down from generations to generation, and that put us at more increased risk of developing prostate cancer. The current screening guidelines are for men 45 and older to be screened for prostate cancer. We're seeing for African American men who have a family history, a brother, a dad, earlier age, 35, 40, should be getting screened for prostate cancer. And someone made a comment in the chat that if you don't ask for a PSA test, you won't get it, right? And so in some cases, people will say, well, if you're younger African American men, you're not you're 35, 36, 37, but you do have a family history of prostate cancer. You need to have that conversation with your doctor so that they can tell you, they can do the workup, because you're at increased risk for developing prostate cancer. So some of it is genetics, some of it is lifestyle factors, the diet, consumption of more red meat. Some of those things will put you at increased risk of prostate cancer. And then some of it is just genetics, is that we get genetic markers. Also, if you had a family history of breast cancer in the family, you can also, that gene, so on the mother side, the sons can be at increased risk of prostate cancer because there's a correlation between prostate and breast cancer, especially if it's in the family.
Thank you, Dr. Cobrand. I don't see any additional questions, but continue if you have a question. We definitely don't want to leave this opportunity without addressing any questions or concerns. Next, let's bring back Chelsea to lead us in the next section.
You got it. Thank you, good sir. Such a powerful conversation, very laid back, very transparent. We started a little slow, and then one question sparked another, and that's what this is all about. You will hear from Chad Workman in just a few minutes. He's going to talk about an opportunity coming up in August that gets at what you all are addressing right now, sharing, networking, talking about your experience as it relates to prostate cancer. So hang on, you will get a little bit more information about that. Next slide, please. I think we are ready for our post survey. So as we are sharing the screen, if you're able, go ahead and scan that QR code. If you're not able to do that, you can click the link in the chat. We're going to just take maybe a minute for you to go ahead and get those responses recorded, and then we will move forward with the rest of the program. So we'll give you just a minute for that. And I would say too, once you're done with once you're done with the post survey, and as our speakers are, checking out the Q&A pane and looking in the chat and answering questions, go ahead, use your reaction buttons. How are you feeling tonight? Use those reaction buttons. Are you excited about being here? Let's show our love and appreciation for our speakers, for our co-moderator, Basila Strickland. Use that reaction button, and let's get active in the chat, and let's see, how you guys are doing tonight. So we'll give you just a couple more seconds to complete the post survey, and then we will continue on. All right, so let's go ahead and move on to the next slide so we can begin to wrap up the evening for everyone. We've been talking a lot about what's happening as you or someone you know or love or support is already experiencing symptoms of prostate cancer. But we have other opportunities where we talk more about prevention, and we talk more about getting involved and learning about studies that are available already in our community. And so, and then ways that you can actually get involved and get engaged with Mayo Clinic. We cover 9 counties here in Florida, as I mentioned. So that's all of the First Coast: Duval, Clay, Nassau, St. John, Baker. But then we also have 4 additional counties: Putnam, Brevard, Flagler, and Volusia. And of course, we're partnering now with our brothers a little bit further to the central area of Omega Beta Beta. So, Seminole County, Orange County, Brevard County. We're covering some wide areas here, and we need people to help share their stories. We need people to lend their voice to our researchers to help design studies. And then for those studies that are already open and available, we need community members to participate. So let me explain to you a little bit about what you're looking at on the screen. And as I'm talking, our tech team will be adding the links in the chat for you. So with our community engagement studios, like I always say this, and some of you who know me have been in other meetings or other events, you may have heard me say, if you're not at the table, you're on the menu. And so our community engagement studios give you an opportunity to get at the table and get off the menu. We have to be able to design and share, give our feedback, if you will, to researchers who are designing studies to help provide interventions to help improve health of our communities. So if you're someone who is very, very opinionated, or you want to share and participate in the design of studies, then we invite you to scan the QR code on the left of the screen with Community Engagement Studios, or click the link in the chat. And then what that will do is it'll allow you to create a profile online and answer a few questions. But essentially, the CE Studios are about a 90-minute virtual conversation. You will hear a little bit about the study itself, and then we will facilitate a couple of questions for you to answer and give your direct feedback to those researchers before their studies are complete, before they are designed. And that is the best way to help have and lift up community voice. Another way to be able to get off the menu and get to that table is to be a part of the community research registry. And so with the registry itself, this one is a national database or a national registry of all of those Mayo Clinic research studies that are open and available for communities to participate in. There's no one size fits all for treatments and trials and clinical trials and research studies and all of that. We need all community members to participate in these particular interventions, because you never know how your body is going to respond to certain things. And we want to make sure that you are a part of that registry to learn about the studies that are open. I tell people as well, and I'm gonna try not to get on my soapbox, but oftentimes, we tend to be number one and number two in a lot of health issues, but we don't know what the treatment is about or where the resources are that are available for us to address and be a part of. Well, being a part of the community research registry will give you an opportunity to do that. So you can either scan the QR code there and then or click the link in the chat. Completing that profile online, you will receive a $10 gift card just for completing the profile itself. It doesn't automatically enroll you in any study at all. It just makes you adds you to a list of individuals across the country that are learning about studies that are open, that they're eligible to participate in. The last thing I'll say on this slide is if you are someone who's interested in sharing your personal story, whether you are a survivor or a caregiver, or someone who has just experienced, maybe you made major lifestyle changes, and you want to share your story, we invite you to put your email in the chat, and then we will be able to reach out to you at a later time. Let's move on to the next slide for time purposes. All right, so I will now toss this over to Chad Workman to explain that friend to friend event that I was just discussing. Chad, go for it.
All right. Thank you, Chelsea. And I want to echo the thank you and the appreciation to the Omega Psi Phi Fraternity Incorporated, and just the awesome, powerful testimonials and stories that y'all have been sharing. And for tonight, gosh, you guys just knocked it out of the park with just being transparent and honest and to the point this evening. So the Friend to Friend program is, in a nutshell, exactly what we've been talking about tonight, as far as with our testimonials with prevention, early detection, early awareness, advocating for your health, knowing your body, knowing and having a support system. So this program is it's a larger program, but this particular iteration will be focusing on prostate cancer, and it's going to be a one-day, 90-minute event where we are asking gentlemen to come together to get to learn more resources and more education around preventable actions to prostate cancer, and then taking that information and sharing it and spreading it out into community. So you're kind of, in a sense, gonna be getting information and getting extra empowerment, because you are all empowered gentlemen as you already are, but you're going to be getting those extra resources and extra education from our one of our physicians here, Dr. Willis, and you're going to be getting materials to help advocate for early detection and early awareness. So increasing behavioral intent, as Dr. Reverend Crudup had mentioned, of watching your diet, and exercising, paying attention to what your body is telling you, and also to increase early detection screenings. We also talked about just recently, how do we get our young men aware of their health? We all go through a period in our adolescence where we think we're invincible. Nothing can touch us. But as you can see in the Black male community and males, and we need to be more proactive about our health and our bodies. So this program is doing exactly that. So what I'm asking for everyone on this call to do is email me to enroll in this training or this event. Is going to be taking place August 15th here in Jacksonville at our downtown collaborative office. And we're only asking an hour and a half of your time to get this extra empowerment. And this event is going to be preceding an event that's going to be hosted in September at the American Legion Post. It's going to be a free PSA screening. So this is kind of a call to action to get everyone on board, to bring your family members, to bring your community out to this free PSA screening event. But gentlemen, when you're in this training, you're going to be assigned the duty to be a friend to another friend, to help them through a diagnosis, to help them through the initial, if they got an initial diagnosis of prostate cancer. You have the life and lived experience to help them through that. And then also to answer their questions about what to experience. We have ladies in our lives and spouses in our lives that they may also have questions. So you can be a point person to them to say, hey, there's a free PSA screening going on in September. I'll come with you to that. I'll be an added support system for you in addition to what they already have. So that's what this program is. I see 35 people on the call tonight, so I should be having 35 emails in my inbox in the morning. So just come out to hear the information. There's no obligation to the information. If you want to get more involved, great. We encourage that. But you can just come and just get the information and hear the material. And that's what we are here about at Mayo Clinic. We're not pressuring you into getting into anything, but knowledge is power, education is power, and no one knows your body better than yourself. So put all that together and do something for yourself and for your community. I'll pass it on over to back to Chelsea.
Thank you, Chad. I appreciate that. Okay, you heard him. He said he needs some emails in his inbox now. Okay, so we look forward to having that conversation in August, and more to come there. So you see on the screen ways to follow us. We have a number of social media handles. You can follow us on Instagram. You can follow us on Facebook, and we also have a community newsletter. That community newsletter gives us it's a wide casting newsletter across the country, and it lets us know what's going on in other areas. As some of you may know, we are one center with 3 sites. We're in Florida, we're in Arizona, and we're also in Minnesota. So we all do the same thing. We just have slightly different communities that we work with. But using or clicking on that link and registering for our newsletter, that gives you an idea to see about what's going on across the country. So we are actually getting ready to wrap the evening up. Next slide. And we will be inviting up one of our study coordinators to share about a clinical trial that's open right now. But before we get to that, here are some upcoming events that we want to encourage you to participate in. If you want a screenshot, you can do a screenshot. Again, our staff will be putting the links in the chat. But on June the 13th, Saturday, June 13th, another of our very strong partners, in fact, the chapter that we started out with this particular conversation way back in 2022, I think it was, the SciMu chapter of Omega Psi Phi. They are hosting a virtual men's health fair on Saturday, June 13th at 10 a.m. So click that link to register for that. We also have another cancer conversation happening on June 16th. And this one is focused on uterine cancer, so women's health issues. So all these fellas that are on the call, get all those women that are in your life, encourage them to scan this QR code, register to hear more about health issues regarding the uterus and uterine cancer and reproductive health. That one is June the 16th at 12:30. It is also virtual. On the right side, you will see that next Thursday, we will have our fourth and final cancer conversation that's a part of this series, and that will be focused on survivorship and prevention. Let me tell you something. If you have not been a part of these conversations from May 21st all the way up to now, you want to be a part of the last event on June 18th, next Thursday. Our Dr. Odedna, she is a world-renowned speaker and researcher in science and prostate cancer, and she is going to be talking about survivorship. And I will mention too that everyone who is registered for all of these various conversations that we've had from May 21st, even including June 18th, all of these will be recorded, and then we will email those out to you. If you notice, it's been a series, and each time we've done this, it's been focused on a different phase of the cancer care continuum. We started with etiology and cause, then detection. Tonight we talked about treatment, and next week we talk about survivorship. So make sure that you scan the QR code to participate next week as well. Next slide. Okay, so now I want to bring up Jessica Hogue. I think yep, there she is. And she's going to share with you a little bit of information about an open study that we have going on right now at Mayo Clinic regarding vitamin D. Jessica?
Hi there. Thank you for having me. So my name is Jessica Hoig, and I'm a clinical research coordinator at Mayo Clinic. And I am working with some of the physicians on a vitamin D prostate cancer study. And the goal of the study is actually to figure out how common vitamin D deficiency is among African American prostate cancer patients, as well as analyze how vitamin D deficiency affects the immune system. So I wanted to share a little bit of information about the study in case anybody wanted to participate or knows anybody who might want to participate. Basically, your active participation consists of 8 weeks of taking vitamin D. The dose that we give is 2,000 international units a day, or 50 micrograms. There are 3 blood draws before and after the 8 weeks of vitamin D, and the goal of those blood draws are to learn your vitamin D and calcium levels, as well as get the immunology information for the physicians. There are 2 physician visits over the phone, one before and one after the 8 weeks. And then for 3 years, the researchers on the back end will look at your PSA levels and any changes in your cancer to see if there is any impact of the vitamin D. You get $75 for participating, and it does not cost you anything to participate in it. And you don't actually have to be at a Mayo Clinic location. This is one of the special studies that is able to go out anywhere. And we are looking in particular for African American males that have a history of prostate cancer and are not currently taking vitamin D over 400 international units or 10 micrograms. So in the chat, I'll put my contact information, the flyer that you see on the screen right now, which has a little bit more information or a little general information, as well as the link to a screening survey. So if you think that you might be interested in the study, if you can fill out that screening survey, it will let me know, and it will let you know if you qualify at the very basic level. And so just let me know if you have any questions. And thank you so much for having me. I really appreciate it.
Awesome. Thank you so much, Jessica. And we are just about done, but just on behalf of Mayo Clinic, we just want to thank everyone for joining tonight and all of our speakers. We really greatly appreciate it. And again, we will be, once the webinars are all complete, we'll be sending out the recordings all at once so that, we can kind of keep everything in one place. But thank you all so very much. And I'm going to turn it now back over to Basilis Strickland to close us out. Thank you so much.
Thank you, Chelsea. Again, thank you, Mayo Clinic, for hosting this evening. We'll take a few minutes to, on the screen, you can see ways to stay connected with Omega Beta Beta Chapter through our Instagram, our website, and many other places. We are currently going through our calendar to plan our initiatives for the rest of the season. So please stay in contact with us so that we can get that information out to our guests and friends of our chapter. To follow us on social media, our Instagram handle is @OmegaBetaCubes. If you're looking for our site, it's OmegaBetaBeta.com. Also want to take Boston Spirit and thank the Health Initiative Committee led by Brother Ray Collier, who I believe is on the call, along with his team, Brother Jeff Drew, Brother Des Extus, Brother Michael Woodson, and many others who I've forgotten. I apologize for leading us to this series. We appreciate their diligence in getting us to the table to be a part of this wonderful sharing experience. Also want to thank Brothers Carrington and Crudup for their very impactful, dynamic stories of motivation and courage. So I really appreciate that as well. Additional resources and information will also be found in the chat. Again, want to thank the Mayo Clinic staff for your assistance in coordinating this event. This recording will be made available to all who have registered. We encourage you all to share information you have learned today with others, which is very important. This concludes today's Cancer Conversation event. Thank you, everyone. Take care, and we look forward to seeing you at the next session on the 18th. Take care.